Unit 9 test questions 3. 67. A clinic nurse is providing instruction to a client with diabetes mellitus about the signs and symptoms of hypoglycemia. The nurse tells the client that which of the following would be noted in the hypoglycemic reaction. 1. Increased urine output. 2. Thirst. 3. Hunger. 4. Polydipsia. The correct answer is 3. Hunger. 68. A client with diabetes mellitus who takes insulin is seen in the healthcare clinic. The client tells the nurse that after giving the insulin injection, the insulin seems to leak through the skin. The nurse most appropriately would determine the problem by asking the client which of the following. 1. Are you using a 1-inch needle to give the injection? 2. Are you placing an air bubble in the syringe before injection? 3. Are you aspirating before you inject the insulin? 4. Are you rotating the injection site? The correct answer is 4. Are you rotating the injection site? 69. A preoperative client is scheduled for adrenalectomy to remove phenochromatocytopenia. The nurse would monitor which of the following items most closely in the preoperative period. 1. Intake and output. 2. Blood urea nitrogen. 3. Vital signs. 4. Urine glucose and ketones. The correct answer is 3. Vital signs. 70. A registered nurse is caring for a client with a diagnosis of Cushing syndrome. A licensed practical nurse is working with the registered nurse for the day. The registered nurse determines that the licensed practical nurse has an understanding of Cushing syndrome when the licensed practical nurse states that the condition is caused by 1. Excessive amount of cortisol. 2. Decreased amount of cortisol. 3. Excessive amount of antidiuretic hormone. 4. Decreased amount of antidiuretic hormone. The correct answer is 1. Excess amount of cortisol. 71. A client with Graves' disease, exophthalmos and the experiencing photophobia. Which of the following intervention would be the best assist the client with this problem? 1. Administer methimazole every 8 hours around the clock. 2. Lubricate the eyes with tap water every 2 to 4 hours. 3. Instruct the client to avoid straining or heavy lifting because this can increase eye pressure. 4. Obtain dark glasses for the client. The correct answer is 4. Obtain dark glasses for the client. 72. A nurse is assessing a client following cranial surgery who is risk for developing diabetes insipidus. The nurse would assess for which of the following symptoms that could indicate development of this complication. 1. Infection. 2. Weight gain. 3. Diarrhea. 4. Polyuria. The correct answer is 4. Polyuria. 73. A nurse is providing instruction to a client newly diagnosed with diabetes mellitus regarding insulin administration. The physician has prescribed a mixture of NPH and regular insulin. The nurse would instruct the client that the first step is to 1. Inject air equal to the amount of NPH insulin prescribed into the vial of NPH insulin. 2. Inject air equal to the amount of regular insulin prescribed into vial of regular insulin. 3. Draw up the correct dosage of regular insulin into the syringe. 4. Draw up the correct dosage of NPH insulin to the syringe. The correct answer is 1. Inject air equal to the amount of NPH insulin prescribed into the vial of NPH insulin.